Good morning, everyone, and welcome. Thank you for joining this FP 2020 webinar on understanding additional users. Over the next hour, we'll take a closer look at one of FP 2020's foundational indicators. I'd like to begin by introducing the speakers and reviewing the agenda for the webinar. My name is Jason Bremner, and I'm the Data and Performance Management Director for FP 2020, and I'll just be moderating the webinar today. I'm joined by Aisha Dasgupta from the United Nations Population Division and Michelle Weinberger from Avenir Health. And both Aisha and Michelle are members of the FP 2020 Performance Monitoring and Evidence Working Group, a group of experts that provides technical advice and support for monitoring progress towards FP 2020's goals. And welcome and thank you for joining us today. We'll begin by providing some background information and context on why we are hosting this webinar. We'll define the concept of additional users as it relates to FP 2020. We'll then illustrate the underlying dynamics of contraceptive use and bring these pieces together to explain how the additional users metric relates to the dynamics of contraceptive use. This will be followed at the end by a pop quiz. I hope you're all paying attention, and we'll try to test your understanding of the concepts presented and also how we've done it explaining them to you. And lastly, there'll be a Q&A session where we will draw the webinar to a close after that. At the London Summit in 2012, the family planning community committed to enabling 120 million additional women and girls to use contraceptives by 2020, thus creating the FP 2020 Global Partnership. The additional users indicator is the first in a suite of 17 FP 2020 core indicators. It serves as one of FP 2020's foundational measures of progress, which we report upon annually for FP 2020's 69 focus countries in our progress report. Since 2012, the 120 million additional users goal by 2020 has helped galvanize efforts to expand contraceptive access, expand method choice, improve quality of care, and overcome barriers to use. But unfortunately, additional users metric is often confused with other related family planning metrics. This confusion was referenced recently by the FP 2020 Performance Monitoring and Evidence Working Group in a statement, and is disclosed in a global health science, and is discussed in a global health science and practice paper co-authored by the speakers in this webinar. And confusion around the additional users metric hinders our efforts to align measurement and improve understanding of collective progress towards FP 2020's global goal. We're continually hearing about this confusion at various meetings when we go out to present and when people ask us about the progress report. And so in order to address this confusion, the FP 2020 Secretariat, Track 20 of Avenir Health, and the PME Working Group continually are working to clarify this metric and others. And as part of this effort, we're embarking on a series of webinars on family planning data to reach a wider audience. And thank you for joining us for the first in this, what I think is an exciting series of webinars. The resources shared today, including a new infographic illustrating the concept and measurement of additional users, will be available on FP 2020's Data and Measurement Hub after the webinar, along with other useful resources. And I encourage you to explore the hub as we further develop and aggregate measurement resources. So at this point, I want to turn it over to Michelle Weinberger to explain additional users, define it for us. Go ahead, Michelle.
So what are additional users? So most simply put, additional users is the net number of contraceptive users above a specified baseline. Or, to put it another way, it's the difference in the total number of contraceptive users at one point in time, a baseline, and another point in time after that baseline, as this formula shows. We get these two total user numbers by multiplying the modern contraceptive prevalence rate in each of these years by the number of women of reproductive age in that same year. The modern contraceptive prevalence rate, or MCPR, is FP 2020's core indicator number 2. This indicator is produced using a statistical model which is informed by survey data and, in some countries, by routine service statistics. The total number of modern contraceptive users is calculated for each year, as described previously. So in this example, we can see the total number of users increasing each year. For SB 2020, the baseline number is the number of modern contraceptive users when the initiative started in 2012, shown by the dotted line on this graph. So for each year, we calculate additional users as the number of modern contraceptive users above this baseline. For 2016, we would take the total number of users in 2016 and subtract out the number of women who are using at baseline to get additional users. As you can see in this graph, additional users captures the population level increase in users from 2012 to 2016. While this looks simple, as you'll see today, once we start to dig below the surface, we find a complicated set of dynamics that exist behind the metric of additional users.
I'm going to talk about the dynamics of contraceptive use. Contraceptive use is not static, and during the course of their lives, women move in and out of contraceptive use for a variety of different reasons. And we're going to take a look at a few examples of contraceptive dynamics for some imaginary women. This arrow indicates one woman using contraception from a point in time on the left, and she continues to use contraception towards a point in time on the right. Perhaps she's using an implant for the whole duration of this time and doesn't need to return to the healthcare provider for a long while. Or maybe she's using injectables and she returns regularly for her next injections. In the next example, an imaginary woman shown in green this time starts to use contraception. So she's adopting a method at this point in time. It could be that she's using contraception for the first time in her life, or it could be that she was using in the past, had stopped using, and is now resuming use again. And then in this example, the woman shown by the purple line was using contraception, and then she stopped. And this is discontinuation. We often think of discontinuation as a negative thing. For example, if she discontinued because of side effects or health concerns or because of partner opposition. And while that's all true, it is important to keep in mind that some discontinuation is because of reasons such as wanting to get pregnant or menopause or not being sexually active and so on. And whatever the reason for discontinuation, it's a very important dynamic of contraceptive use to be aware of. If we were only to pay attention to what's happening with women indicated by the green line, so observing and counting only those women who start using contraception, we'd miss other crucial pieces of information on what is happening with contraceptive dynamics on continuation and discontinuation. So these dynamics, continuing, starting, and stopping, describe the contraceptive status of individual women over time. And we could get more complicated and talk about method switching as another contraceptive dynamic, but for the purposes of talking about additionality, the type of method isn't relevant, as we're only focused on use or not. Aggregate measures of contraceptive use, such as additional users, are limited in their ability to describe the dynamic nature of contraceptive use over time. We only know how many people are using, and we can't say anything about the dynamics of that use. But further to this, HMIS systems and service provision organizations often collect data on individuals. For example, clients or adopters, first-time users, and so on. And while that helps to give us an understanding of what's going on for women indicated by the blue and green lines, These types of data are unlikely to provide a full picture of contraceptive use dynamics. So we're now going to put these two pieces together. We've defined the additional users metric and discussed the dynamics of contraceptive use. So we're going to bring those two concepts together now. Let's take a look at an example for 11 different women. Each line and color represents an individual woman. The horizontal axis is time, and let's imagine that we're starting in 2012 and ending in 2016, which is the most recent year that FP 2020 reported progress towards 2020. The purple and green women, so those are the two lines at the bottom, were using at the beginning, and they continue to use throughout the time period. These are continuers. There are two of these women, and they're straightforward to follow. But there's a lot of other events going on as well. Some women who were not using contraception in 2012 begin using contraception during this time period. These women are represented by the circles which drop in from the top at various points along the graphic. For example, the orange, dark green, and bright yellow women adopt contraception at various points in time. And finally, some women who are already using contraception or begin using contraception, they stop or discontinue. And these women are represented by the three circles which drop out under the graphic. For example, the dark blue, the pink, and the gold. So overall, there are 2 women who continued throughout this period, 7 episodes of adoption, including 1 woman who starts and ends up discontinuing, and 3 episodes of discontinuation. Now let's count the total number of users at different points in time. In 2012, there are just 4 users of contraception. And between 2012 and 2013, the blue individual discontinues, so we're down to 3, but it's replaced by an orange individual, and also a pink individual adopts. And this means there are now 5 users of contraception in 2013. If we continue adding and subtracting in this way to 2016, we can see that there are 8 users in 2016. Estimates of the total number of contraceptive users at different points in time are used to calculate the number of additional users, or in other words, the overall change in the level of contraceptive use in a given population. Because it's an aggregate metric, the term additional users cannot be used to describe specific individuals. Instead, it refers to how the overall level of contraceptive use in a population changes from one point in time to another. Note that if we had counted adoption episodes over the 5 years, we would have counted 7. These individuals are represented by the lines which curve upwards with colored arrows at the beginning. If we'd counted adopters still using in 2016, we would have counted 6, since the pink adopter discontinued use between 2013 and 14. But neither of these numbers is the same as additional users in 2016. As we've seen here, adoption and additional users are not the same thing.
Aisha has just walked us through the dynamics that sit behind measuring contraceptive use. If we zoom in to the 8 women using modern contraception in 2016, represented by the colored dots on the screen, we can explore this further. If we only count individuals who adopted contraception after 2012 and were still using those methods in 2016, we would count 6, as shown by the green bar. Remember also that we had the pink dot representing a woman who both adopted and discontinued between 2012 and 2016, who does not appear here. So if we counted the total episodes of adoption after 2012, we would have come up with 7. However, when we look at the aggregate, rather than the individual, we see that in 2016 there are only 4 additional users compared to the 2012 baseline, as shown by the orange bar. This is because, after accounting for all of the dynamics of continuation and discontinuation, we end up with 4 more women using contraception than there were at the 2012 baseline. Therefore, counting adopters, or episodes of adoption, and additional users are not the same thing. If we only look at an adoption, an individual level metric, we don't account for the full dynamics of use at the aggregate level. It's important to note that we're not saying that one of these measures, either individual or aggregate, is better. Rather, both are important and useful to answer different questions and tell us different things about progress. The key thing to remember is that individual measures, such as adopters, tell us something different from the aggregate measures of additional users. The two cannot be directly compared. However, models exist that allow for individual level measures to inform aggregate estimates of contraceptive use. We have just seen that adopters are not the same as additional users. In addition, many people mistakenly use the term new user interchangeably with additional users. The term new users has multiple definitions, including women using contraception for the first time in their life, women who are new to a specific service provider, or women using a specific method for the first time. Regardless of its meaning, new user refers to an individual along with other individual level metrics like adopters or first-time users, and therefore it cannot be used interchangeably with the aggregate measure of additional users. Being clear about what we count and what we mean is important. Metrics, especially when used by donors and governments to set goals and measure program performance, can drive how family planning programs are designed and implemented. Using the right metrics ensures that program growth translates into additional impact, gives credit for ensuring that current family planning clients have continued access to services, and links programmatic increases in contraceptive use with expanded national coverage, not just attracting clients from other providers. If you want to learn more, we'd encourage you to read our paper on additional users that myself and Aisha wrote, along with our 2 co-authors, Ben Bellows and Wynn Brown, who we'd also like to thank and acknowledge. A link to the paper is included in the webinar invite, and you can also find a link to it on FP 2020's Measurement Hub.
Thank you, Aisha and Michelle, and thanks for walking us through the metric additional users and the contraceptive dynamics as well. I hope that all of you have been paying attention because it's quiz time, and we hope you've been following along. You'll see now in your quiz panel a series of answers to the question. Additional users are A, individuals who start using contraception for the first time, or B, the net number of users when comparing the total number of users in a specified year and the total number of users in a baseline year, or C, new clients measured using health management information system data from clinics or HMIS data, or D, individuals who had previously stopped using contraception and begin using again. Take a few minutes to think and come up with your response. There is only one response to the question, one correct response, and we'll provide the answer during the Q&A session. Good luck.